to our first session for Symposium 2021. We are so excited. This session is There is No Health Without Mental Health. And what a great title, and so true. HFA has actually made a concerted effort to focus on supporting mental health this year. And it's so important to us that we wanted to make it our first session of Symposium. Tonight's session will last roughly an hour from 5 to 6 p.m. Eastern Time. And we're honored to have Debbie De La Riva as our first speaker of this evening. And Debbie is absolutely amazing if you don't already know her, and this session is so timely. Tonight's session is being simulcast in Spanish. If you'd like access to the Spanish translation, please click the globe at the bottom of your Zoom screen and select Spanish.
La sesión de esta noche se transmitirá simultáneamente en español. Si desea escuchar la sesión en español, haga clic en el globo terráqueo en la parte inferior de la pantalla y escoja el idioma español.
There will be time for Q&A at the end of the session, so please use the chat or the Q&A box to enter your questions, and I'll be collecting those. And if you have technical difficulties or you need to speak to an HFA staff person, please put your concern into the chat box, or you can also use our Slack environment, #helpdesk channel for any concerns or any technical issues that you're having. But before we begin our session, I would like to take a minute to thank our sponsors. So thank you to our sponsors for Symposium. Their support of HFA has been a partnership that we truly value. They've been so patient and understanding as we've moved to virtual 2 years in a row now, and we're so appreciative. And don't forget to go to the HFA exhibit hall throughout Symposium to visit the sponsors' virtual booths. And I think you're going to like how easy it is to navigate. Again, thank you so much for joining us for our first session of Symposium 2021.
I am so excited to be a part of the Symposium in general, and just to know that of the first session, I woke up this morning and that was the first thought in my mind. And then, of course, a wave of anxiety came about. Oh my goodness, I'm the first session. How did that happen? And you know what? I'm just so pleased by the fact what HFA is doing to promote our awareness of mental health and how it's coinciding with our bleeding disorders. HFA has stepped up to the plate, and I wanted to be that person to show up too, because this is phenomenal. Later, I'll tell you about some other programs that HFA is doing for our mental health. So let me go ahead and get started. This whole presentation is going to be about this notion. It's an obvious one, that our body affects our mind and our mind affects our body. But yet it's not so obvious how that actually happens. And so the reason I titled this way is because within that knowledge of how these two parts of us are interacting, when you have a good handle on that knowledge, you really have a good handle on being able to optimize your health. Once you figure out and have some self-awareness about how these two are coexisting, basically. So the next slide. So as I was putting this presentation together, I said, how can I show this scientifically, how our mind and body and early experiences come together and how they influence and interrelate. And it didn't take me long to remember Psychology 101 back in the day that they, Kaiser Permanente and CDC did the largest longitudinal study on how our early childhood experiences translate into the impact it has on us mentally and physically. And, you know, it's a very ambitious research project, as you can imagine, and it is the largest known so far. It involved over 54,000 people. And what they did, they had to put some parameters. So what is an adverse childhood experience? Well, it's anything that having to do with abuse, be physical, sexual, emotional, neglect, whether that is physical or emotional. And then as you're growing up, these household challenges of, was there mental illness within the family members? Was a parent being treated violently? Was there divorce? So was someone incarcerated? And of course, was there substance abuse in the family? And later on, Sharon's going to be showing you more about this research and how you can look for it yourself and as well as all the different studies that I'll be talking about. But the impact is right there. 61% of us have had the experience of one or more adverse childhood experience. And then there's 16% of us who've had 4 or more. The reason why this is so important to know about this and to make that link between how you're doing now in relationship to what you grew up and experienced is, it's so important that we understand now the hows and the how much of the impact it has. And so just give you some examples. This is like a 100-page document, patients, but they came up with, if you're someone who suffered with physical abuse in your family, you're 47% more likely to have diabetes later on, 25% more likely to have a heart attack or a stroke. And when it comes to mental health, these individuals are 52% have 52% more of a chance to develop some type of mental health condition. So, there's the facts. This is what we know. And, excuse me one second. And would you mind going to the next one? And so what I really wanted to understand is the how. And within this triangle, you're going to be able to see how our early life experiences would lead up, kind of a cumulative impact it would have throughout our lifespan. Well, in the beginning, what we know is that when children are taking in these stressors, we now know that it really affects their neurological growth, has all kinds of impacts on the way we perceive the world or the way that we deal with stress within our body. And then it goes into how we think and feel and behave. And we know that when we're trying to cope and we're in survival mode, many times people resort to high-risk behavior for all kinds of different reasons. And then we're talking about the top cube here. I also want to let you know that the CDC has now revamped this triangle where there's 2 more tiers below, where they now are able to have information about the social impact of inequality or all kinds of poverty. So later on, I'll show you that there's another cube to this, and it's so important. Next slide, please. So this was a tough slide to put together. What is the definition of mental health? The simplest one is this. It is basically how all of these different puzzle parts put together. It involves your emotions, your thoughts, and your behavior, how it all interacts with our body. And a lot of misnomers have to do with this slide itself, because the idea is this: mental health doesn't mean that there's just an absence of a mental health condition. Just like physical health is not the absence of a physical condition. Point being, living with von Willebrand or hemophilia, that doesn't mean that we're physically ill individuals. We're living with a physical condition. Another thing I'd like to point out is that it is not the type of situation where somebody has a mental health problem and I don't, or you don't. It's a continuum. And if you're really, really honest with yourself out there in Zoom land, you know that there's been periods of time where you have struggled with depressive feelings and thoughts or anxious thoughts and gone through a wave throughout your lifespan, just depending upon what's happening. So my job is pretty much a pretty difficult one here, and that is to show you how the thoughts, emotions, behavior, and body go together. If we were in person, I could make this a whole lot more lively, but let's just look at some simple examples. Let's say you're watching a scary movie, and the movie's over, you're all alone in the house, and you hear something. That's a really good example of how your behavior has then been impacted by your thoughts and your emotions of fear, and then you have that physiological response, right? Well, let's think about it too. I wanted to let you know, before I said the next thing, I'm a therapist on an online platform, and I have the privilege of having a front row seat to see how all these puzzle pieces are interacting. One of a client, without giving any information, struggles with the thought that if you're not married by a certain time, due to her cultural and familial messages, then you're never going to get married and you'll never be happy. Well, that's an example of a thought that's leading to a lot of emotional strife, anxiety, and crying spells. So that's an example of how that all comes together. So go ahead and I wanted to also reference a study. It's hard to try to figure out what is the mental health status of our community. That's an impossible question to answer. At any point, we have somebody struggling maybe to get out of bed, and we've got somebody summoning all the different mountains in different continents. It's like summarizing the mental health status of America. But later I'll teach you how to find this information. But I did find a really, really important study, and it's called The Mental Health Disorders in Hemophilia. It's a systematic literature. And what this particular researcher did is they came up with, 2,315 different articles or research studies, put 28 studies together, and began to try to wrap their minds about the mental health of our community. And before I actually say the numbers, I need to give you a disclaimer. I'm going to give you some numbers, but that in no way means that you or your child or your husband, whomever, has this percentage chance of developing depression and anxiety. What the researcher found is in 2021, we still don't have consistent measurements of all of these different states. So I just wanted to put that out there. But they did show that living with, and they focused on hemophilia, life with hemophilia in that particular snapshot, they said has a 28% increased chance of developing depression. When you put depression and anxiety together, the numbers got really higher, 39%. But again, we're studying, this could be mild, moderate depression or what have you. So keep these numbers with a frame of reference. My job is not to scare anyone or to create a heightened sense, but it is about to understand this. The fact that you and I live with a bleeding disorder, I say I because I'm a symptomatic carrier and a mother of a child, of an adult, 26 years old with severe hemophilia. It's just to say that we know with our literature with mental health, just having a physical condition is a risk factor for developing some a mental health condition later on down the road. So next slide, please. So how does this happen? Excuse me, let me I need to move the zoom to the other side. That's okay, I'll just go by my notes over here. How do we know? Well, let's look at that puzzle. Let's just start with how we think. Now, when I'm going down these particular listings of characteristics of mental health conditions, symptoms rather, I want you to be thinking the question in the back of your mind. How is the way I think interact with the fact that I'm living with a bleeding disorder or have a loved one that is? The first one I want to say is about increased sensitivity. When I say those words, I'm not talking about an individual who is sensitive. Many times it has a negative rap to it. It's not about you being sensitive as a weakness. It's more like you're very, very aware of the people around you and their feelings and emotions and what they're doing. And that is a risk factor. We have some amazing individuals in our community, people like Carl Wexler or Wade Cook. These individuals really understand and feel what other people are going through. And that sometimes you can take on people's feelings. That's where it's a setup about maybe developing anxiety or depression. The next one is apathy. Brothers and sisters, what I want to tell you this, the opposite of depression is not happiness. The opposite of depression is being involved in your life. And when you're feeling apathetic, which is one of the depressed symptoms, you can imagine all the implications it has for how you interact with your bleeding disorder. This whole thing about feeling this disconnection and otherness, we know now that the feeling of loneliness has been documented to have the equivalent effect of our physical and our mental health as having 3 packs of cigarettes per day. We know loneliness impacts us, and we know for those of you, and I'm probably not talking to the people on the Zoom, but for the people who don't get involved and allowed to connect with each other, we know that can be really persistent. Hopelessness and helplessness. Um, a lot of people, when I say excessive rumination, if I could see you, you'd probably be nodding your head. I'll tell you an interesting thing about excessive rumination. It's actually a protective coping skill that we can have. The idea is this: the more and more I think about this bleeding disorder or whatever, the more likely I'm going to be able to see all the different things that could happen and therefore be more ready and be more prepared. But then we know that rumination can take a life of its own. Unuseful thinking patterns. You might have been in a presentation to see this before, but psychologists have come up with some really common thinking patterns that all of us get into, but that have been linked to exacerbating, however you feel about how you're feeling, depression or anxiety. Some of them, I'm going to read a couple of them, and I wish I could see you because I know I would see, your heads nodding. One of them is catastrophizing, thinking the worst scenario is going to happen. My heart goes out to a lot of people who have had children with a bleeding disorder after having family members who suffered different consequences because we didn't have the adequate care, the adequate knowledge. I think about that a lot. And it's really easy to catastrophize that. One of them is overgeneralizing. I've used this example before. It's the kind of thing that if you just get your car washed and then a bird decides to do its thing on the windshield wiper, on the windshield, you go, oh my gosh, this is just, I can never have anything nice. That's an example. I remember when my son was going off to kindergarten and in the second week he had a knee bleed. I overgeneralized to, oh my gosh, this is what life is going to be like. It's those kinds of things. The other thing I want to tell you about unhelpful thinking patterns is actually the person developed it. His name was Aaron Beck, and he was studying people who live with chronic pain. And that is exactly where he came up with these unhelpful thinking patterns and identified with them. Core beliefs. Wow, I could talk about this one for a long time. This is what I do for a living, is I help people understand what are those absolute truths that they hold in their heart and about themselves and the world. And this goes to Sharon. So what is this? Absolute core beliefs are, again, these are absolute truths that you have about body and mind and about yourself and the world. These are things like the world's not a safe place, things that I'm not enough. Another one is that there's really no one else in the world that would understand me. And these come from the very early interactions you have with, usually at that time, the people living in your family of origin or the family that raises you. Next one, please. And this is actually, the way to look at core beliefs is this. It is like putting on a pair of sunglasses, and that's how you see the world. Meaning that I have this bleeding disorder, therefore I view that I'm going to have limitations for the rest of my life. Or I have this bleeding disorder, and that means that I can be somebody to give hope to somebody else. Core beliefs go both ways, positive and negative. And the next one. And it's just this. It affects everything in your life, the way that you think, feel, and behave. Therapy sometimes can be a pretty scary word to a lot of people. But if I could just be that person in your life to let you know that it's not so scary, it is simply identifying these core beliefs that you developed a long time ago, and usually by some pretty unhealthy people, and you begin to question their truth, and you begin to but you begin to develop another narrative that's just a lot more empowering, like we all deserve love and health. Next one, please. And so this is an example of a tool that we use. I use when I'm doing therapy with people. What is core beliefs? I describe it like I just did. And people kind of get this. If you feel like you're a failure, you're just going to feel like, why bother? I'm never going to be good at school. And it affects how you feel and behavior. Except for the other one. I'm perfectly capable. I have challenges in my life. and I know that I have also the capabilities of getting through them. But just to let you know, some common core beliefs if you were raised in an unhealthy situation is helplessness, unlovable is a really worthlessness, or I am not enough, and then external danger. And I imagine, I know what I was feeling when I was raising my little baby with hemophilia. I had a big worry about the world itself, and because I didn't have the resources, I didn't have the knowledge. But today, like other days, you're standing up for yourself and you're figuring out the knowledge, or just it's getting reintroduced. Next one, please. All right, so emotions, that's the other part, right, of the puzzle. Well, let me just say this, that when you're born how you are, meaning that you might be someone that's just more prone to feel really, really intensely about things, and really passionate. And then you begin to interact with the world, and it can intensify the situation, or if you get the adequate coping skills, it can really, really help you deal with the intensity. Emotional irregularity, this is what I find so much with clients and sometimes within our community. It's that thing that I'm so upset or you become so scared that you really don't have the ability to shut it off. Our brains become hijacked by all of this stress and this cortisol and this adrenaline going on, and you don't see a different way of managing it. Same thing with psychological flexibility or inflexibility. This is a real fancy way of saying when adversity comes to my door, I have a certain way of dealing with this, and I just can't deal with it any other way. Many times this can lead to substance abuse. It can lead to, well, all kinds of different things. We just have to understand what our emotions are, and then we've got the keys to hopefully redirect this and change it. Self-esteem. This is where I hear a lot in the halls of the conferences that I've gone to within the bleeding disorder. People develop certain ideas of their capabilities based on their bleeding disorder. And it just kind of takes on a way of thinking, and it goes on and on. I'll never forget when my son was born. It was the first day, and my husband said, "Oh my gosh, he's just been alive for a couple of hours, but yet life itself will show him all of this limitations." And I knew that's I knew that's not the way we wanted to go. And so how you combat that is recognizing I'm not going to view myself or my son by the fact that his blood doesn't clot. I'm going to get knowledge. I'm going to get knowledge. I'm going to get empowered. And I'm going to connect with people. That's how you can deal with low self-esteem was one of them. Next slide, Sharon. All right, so here's the other thing. When you think about mental health, you think about how you act in relationship to this. And there's a couple of things that we know, especially depression, that when people are in a depressed state, they really have an impairment in self-care. That's really important to know because for a couple of reasons. Think about that person in your life that they just kind of seem always depressed and downers, Eeyores. And our message to them is that you just need to read self-help books or exercise, or you need to pray more. This is what we do. We don't understand that that is just simply a symptom of self-care. It's nothing you can just turn back on. We know within our community, and again, this has to do with some research about hemophilia. It's called the interrelationship between depression, anxiety, pain, and adherence to treatment. We know by the research that those individuals who are having more depression, they're less likely to either use prophylactics or to maintain the routine. So what they came up with is that this is a study in 2019, over 200 participants. Again, keep in mind that these are adults. They came up with those who have hemophilia at that snapshot in time. 54% of them were feeling having the symptoms of moderate depression, and 52 were having symptoms of anxiety, moderate and severe. But again, I want you to hear this, but not get wrapped up in the numbers. Get wrapped up in the sentiment that we just know it's a problem. And it also didn't just affect self-care. The behavior associated with mental health doesn't just affect adherence to treatment. It also talks about their ability, their perceived ability to control pain, and more importantly, those tended to have a smaller number of people within the support system. So again, I'm just trying to show you the different connectivity of everything. The next one says risky behavior. I don't, and I'm going to put that also with increased use of substance abuse. I wish I had the stats about substance abuse within our community, but I can tell you to the fact of risky behavior. When someone sometimes has a medical condition that has some kind of self-limitations, many times there's this idea that we have to do more, we have to be more in order to make up for what our body is not doing, which is considered to be perfection. I'll never forget a guy told me in one of the conferences that when he was a kid, he was that guy that would make sure that he would do the most risky, activity on the bicycle, jumping the ramps and what have you. And he would never let anyone in on his pain because he had to show them, he had to make up for what he thought people were thinking less of him. The next one I want to talk about is motivation. This is really, really important, and this is why HFA is so important, is because when you have mental health conditions, many times it has this downward spiral of motivating. You're feeling kind of down, you're not as active, you're not going to go to different chapter events, and then you have this idea and then what happens is life shows you, well, if you're not going to show up, we're not going to show you positive things that can happen from being connected to other people. And it just kind of goes in a downward spiral. Next one, please. All right, now this one is the way that I can show you, probably the fastest way, how our body affects everything. And many people have seen this before. We know that we have a stress response, and we know that when we are startled or we think we're in danger, there's this whole cascade of things that happen in different parts of our body to get us ready for stress, meaning that our breath gets a little bit more shallow, our heart rate gets more profound, and it's basically all these chemicals going to different parts of our body that is just getting us ready. Things like going to the liver so we have more sugar, and things that blood pressure. And this is why stress creates all kinds of havoc within our body. And then we know too that being stressful for a long period of time can create increased weight, and that can increase body images and all the self-limiting beliefs that go with this. So that's what I wanted to tell you about. It's probably something that you already know though. Next one, Sharon. All right. This is a slide that we could spend a lot of time on, but it's really important. What I want you to do is focus on that graphic, because we have evidence and repeated studies to show that when somebody lives with chronic pain, there is both a propensity to be more depressed, and to be more depressed adds to your perception of your pain being even higher. And it just kind of goes round and round. Think about it, any of us, when we're in pain, we're going to avoid the activity, and therefore our body is going to have a decreased conditioning and decreased wear and tear. And then you're going to further avoid it because it hurts. And that leads to anxiety and depression. And again, it's that thing at the very bottom of the first circle, increased perception of pain. I think that is probably the one of the most profound graphic I can show you about the connection between physical body and our emotional well-being. Next one, please, Sharon. Let me check the time. All right, so This slide gets a lot of attention. This slide is something that a lot of people have been asking about in understanding what is the impact of medical conditions on promoting or maintaining post-traumatic stress syndrome. Before I talk about this slide, I need to do a couple of caveats. Here's the idea. All of us have experienced some type of traumatic event. It doesn't mean that we're going to go on to develop full-blown PTSD. In fact, they're saying with medical conditions, about 13% of people go on to develop PTSD as a result of a medical condition. But it is also, there's a truth to it. There's something we have to be aware of, because we do know that experiences later and can lead to all kinds of complications. And so I wanted to present this slide to create some clarifications that yes, the experiences associated with a medical condition can create traumatic experiences. That can create PTSD. And again, there's all kinds of different severity levels of PTSD. So again, I've done the disclaimer enough, and let's go into what is PTSD in the first place. A couple of things have to be involved. There has to be a traumatic event that has either happened to you or that you've experienced. And that's why, like things like a natural disaster or events can create this. Here's the clicker too, is that it's not just the event itself can be a real danger or it can be a perceived danger. So that's really, really important too. And that speaks to the fact that something that might be traumatic to me, it is not traumatic. But if I perceive it to be so, then it is. There's some symptoms that have to happen in order for someone to be diagnosed as PTSD. One of them is re-experiencing the symptom. You probably heard about people having flashbacks or memories. That's one of the phenomena associated with PTSD. Another one is avoidance. And that's why I wanted to present this slide, because think about it. If we have a trauma associated with living with von Willebrand's or rare factor disorders or what have you, if we've had that, and one of our ways is to avoid it, well, that can involve things like not going to chapter events, not following up with your doctor, avoiding all types of, people, reminders of it. Really, really important to be aware of it. Also with PTSD, it can result in a lot of negative thoughts that you have, or emotions. You know how I started in the beginning of the presentation about your thoughts of the world? Well, one of the negative emotions that can come by if you've had a bleeding episode that's gone on for a period of time, you can develop an idea of helplessness, a lack of control. Maybe this is something I can't control. Again, I'm not saying that's something that everybody's going to go through, but some people do, and it's real. All of this is real. Also, arousal and reactivity. This is probably a good way of describing that as somebody that's come back from a war zone, and all of a sudden, firecrackers go off. It's July 4th, and they're decking for cover, and they're having the same physiological reaction they did when they were in the way of active fire. It is that increased arousal that you're just kind of on edge. There's a researcher that, again, I think Sharon already put it into the chat. It's the third research that I'm going to be talking about. It's called an enduring somatic threat model of understanding PTSD. And this particular person came up with an idea, and he showed us how having a medical condition can lead to these different symptoms. In the part with medical conditions and PTSD, this arousal reactivity could be, oh my gosh, I'm experiencing those initial sensations of a bleed. And then you become hyper-focused on that. And that could be the focus of your day or the focus of your well-being for quite some time. That's kind of an example of how the medical condition of living with a bleeding disorder can add to this. a lot of other caveats. It's something that these symptoms, you need to have all of these, and they must last for more than 1 month. And then the other part of it is that it has to be something that's so profound it's affecting your daily life or your relationships. So that is what we know so far about PTSD and mental health conditions. I mean, in medical conditions. The next one. I would have to say, this is probably, after saying all of those words to your right, you might be incentivized to, I've got to figure this out. I've got to see how living with a bleeding disorder is affecting the way I think and feel and how I conduct myself in my life. Well, after I go through this slide for the next minute or so, if you feel like you have been to therapy for a second, that's okay. In fact, that's the desired effect of this slide, because I just want to show you how our earlier life does form these core beliefs like we've talked to before. And whether we realize it or not, we take along all of that baggage, positive and negative, to every different type of scenario that we encounter in present day. So what a therapist would do is would help you, look into, gosh, why do you get really, anxious around June? What is the deal with that month? And then you begin to understand, oh, that's the time when I was diagnosed as having an inhibitor. And that's why I'm very nervous all the time, and I get super protective, and I withdraw from people. It's those kinds of connections that if you can bring it out to the awareness and bring it into the light, then you can begin to have that power to restate how you feel, to challenge that thought. So this particular slide shows you what happens, and what it's meant to show you hope. Because if we can just understand ourselves better, we then have power, and the power is to change and to challenge. So I think that's all I'm going to say for this particular slide. And if you wouldn't mind going to the next one. Well, it wouldn't be responsible for having this kind of presentation without also showing the flip side of it, right? The resilience, ways to promote resilience. So I wanted to end on a positive note, partly also maybe you'll give me a better evaluation. I don't know. No, that's not why I did this. Let's talk about resilience and components of it. Self-awareness. That's exactly what I was been talking to you the pretty time. You got to understand what the triggers are. You have to understand your coping skills. Are you somebody to just recoil when things get too tough? Are you somebody who feels like they have to be completely perfect because that's just a way to compensate for low self-esteem? So much power is in self-awareness and self-acceptance. I heard one of our gentlemen, I can't remember his name was Guillermo, last name. I was so struck when he was presenting his story of living with hemophilia, and he told all of us that the moment he accepted that his blood doesn't clot, the moment he accepted that that is a part of who he is and just a part of who he is, his life began to change. He became friends with it. He began to, feel whole again, also while living with hemophilia. The ability to adapt, you can't underestimate this. I think that the person in our community that this resonates with the most for me is Chris Bombardier in the film that Patrick Lynch made. Let's Talk Mental Health. Also Bombardier Blood. Chris reached this fork in the road in his life where his baseball career couldn't continue. And that was a devastating blow for him. And for those of you who know Chris Bombardier, he later decided, well, okay, so then I'm just going to climb the 7 highest summits in the 7 continents of the world. He had to adapt. He had to pivot. Psychological flexibility, again, that is, okay, in the past I have dealt with this stressor this way. I don't necessarily have to continue anymore. I can think something differently. I can behave differently. And then healthy coping skills. There's a lot of stars in our community, but the one that resonates most for me is the story of Barry Hardy, because Barry told me that what he did, there was so much hurt and shame associated with not just having Hep C, HIV in his family. There was so much hurt. His solution was to not meet anybody else, to just stay and talk within his family and live within his family. But it was the day that he accepted an invitation to HFA's Blood Brotherhood program that he decided to stop withdrawing and start connecting. And I think all of us, or a lot of us, know what happened then. He became an icon in our community by biking around, the United States to help people who don't have access to Factor around the world. Healthy coping skills. So the next one, please. All right, I wanted to make sure, I might have felt like I rushed to the presentation, but I wanted to make sure we had time for resources. Okay, so a couple of different resources. Please look in the chat, and you're going to see these different research studies that I've shown to you. And if you're interested in this, do that. Find out more about it. Also, I just can't go on enough about HFA and how they have rose to where we needed them to be, and have always been there, about addressing mental health. In fact, if you go to their learning center, and maybe Sharon can tell you how to find that or put it in the chat, you're going to find a whole page on mental health and different resources. Also, I think it's so important for people to understand that you too can find out all the different research studies regarding the psychosocial aspect of living with a bleeding disorder. It's right there. It's called PubMed, and you can access it just like anyone else. Also, just do a shout out for the World Federation of Hemophilia. If you are a member of that organization, you get access to the Hemophilia Journal, which is under PubMed. Just a shout out to let you know about that. This next thing is a workbook, and that's because not everybody needs to go through extensive psychotherapy or to get on psychotropic medication in order to make their life work with them and for them. There is a publication warehouse called New Harbinger Publications. I love this particular one, the Mindfulness and Acceptance Workbook for Anxiety. You can work through these concepts, apply them to your life, and I'm telling you, they can be life-changing. Also, later on tonight, if you're not zoomed out, anybody can access a screening for mental health. If you go to Mental Health America, Mental Health Screening, and on the website there, you can have an online confidential screening for anything from bipolar disorder to PTSD to borderline personality, you name it, it's all there. All those things that can happen to us or we can be a part of. You can just get an accurate idea. I call it check up from the neck up. Understanding more about yourself. And then it also gives you great resources if you are someone that's struggling with different aspects of depression and anxiety. And yeah, I think that's really what I wanted to say, and I really wanted to save time learning, and this is where the support happens. So feel free to put on your video if you'd like to. Make sure you unmute yourself, and you can do a couple of what resonated with you with this presentation, or the thought is that how is living with my bleeding disorder affected the way I think or feel.
Well, Debbie, I just want to thank you so much for sharing your time and expertise with us. And also, if you guys have questions for Debbie, if you can, just either put them in the chat and I'll pull a few of them out. But I do have a couple of questions that people sent me. And also, if you're interested in we have a PTSD session on October 27th at 5 p.m. Eastern. So make sure you check that one out. But the first question I have for you, and while you're doing that, I'm actually going to pull my slides back up. I'm toggling between the slides, so I want to make sure I get everyone up there. But I love the title of this session because it's all about, mental health is just as important as physical health and all different areas of health, because we're a whole person. Why do you think we tend to separate that? We just think of them in compartments, and we're a whole person.
Yeah, so many different thoughts of that. I think that we're just under the physical model. The physical model is okay. So there's a lot of symptoms. These symptoms now create a diagnosis, and then there should be some type of cure. There's got to be something to fix this. I think that's one of them. And the other thing is this is completely stigmatized. How we stigmatize mental health is that we collectively have drank the Kool-Aid and bought into the concept that it has to do with weakness, that it has to do with being less than. And there is just, we're making so much progress. I mean, incredible progress. But we still have a long way to go. And I love to see how the stars are tackling this. People like Lady Gaga or Demi Lovato. I mean, they're just being out there and open. It has nothing to do with myself as a character. Just like the fact that my son's blood doesn't clot doesn't have that overall overreaching truth about who he is. It's just a part of who he is.
So one of the other questions we have is, I used to be very active in my local bleeding disorders community, but since COVID, I found it easier to just stay home and keep to myself. And I'd like to start getting involved again. Do you have any suggestions for how to start getting back, socializing again? Because I can see how it'd be very nerve-wracking.
Oh yeah, there's research that to validate your question, by the way, it's called COVID closet, and it's a concept that's happened. And we're all trying to renegotiate this and figure out how to get out of these habits of just staying inside. And I think my best advice about that is living intentionally, meaning that that's something that's obviously very important to you. And so you turn that concept into intentional living. If that's the case, if I want to get out there, what are the steps that are not so anxiety provoking for me? Like, reaching out to a dear friend again. And it really is just about that, recognizing I've gone a little bit too far in, and you can reach out for people for support too, because a lot of us are going through that. So if you just don't want to go to the concert, you don't feel comfortable, what have you, just inviting a friend over to listen to music. It's those kinds of things. But it all has to do with intentionality and understanding that it's real.
So I guess another question would be, we do have periods of depression in our lives, or just feeling down. Are there points where we should take notice and say, yes, I think this is more serious than maybe last time it happened or something? I don't know if I'm explaining that correctly. I'm not a mental health professional, but you get where I'm going with it though, right?
Oh yeah, I don't think I've had a presentation without that type of question. How do you know just sadness and not clinical depression? How do you know if I'm just stressed out to my max, but I don't have an anxiety disorder? And so the how do you knows, that's kind of the easy part, the how to. Well, you would just simply find out more about it with reputable websites, or to go see someone, and you can actually go to screenings to find this out. So that's the obvious answer. And then the not so obvious answer is, what you really have to do is take an honest assessment of yourself and look at, how are these symptoms of depression or sadness affecting my ability to be in my life? Meaning that, what's the impact? That's one of the parts of it. And the other thing is control. How much control do I have over these symptoms? Is it like my body just decides to cry? for a couple of hours, or is it, do I have control over it? So getting a screening, being honest with yourself, and looking at about how the impact is to your life, and then how much control do I actually have over this sadness or this alcohol?
So another question is, there are more people needing access to mental health care than there are trained counselors and therapists. Do you have any suggestions on where to go to get access to care?
Absolutely. So I wanted to kind of give a shout out to online therapy. That's I hear what you're saying. The feeling is there's not enough mental health professionals, and that's probably very accurate. Also depends upon your geographical location. But online therapy has really helped people who would never think about going to somebody's office, and the costs are not as much, a little bit less than going in person. So that's one of them. Another thing is that it doesn't always require a mental health professional. Maybe you need some support. Maybe you think that you're having symptoms of, obsessive compulsive disorder, for example, and you just need to find a support for people. So it's hard to. It's one of those things. It's just like it was with our bleeding disorder. The minute my son was given that diagnosis,
Did we lose her, or is that just me? It's always the question on Zoom. Oh, I think you're back. Oh, good, good, good.
oh darn it. Huh. Okay. I have no idea how long I was
Can
talking
you
to
repeat
myself.
everything you just said? No, Daisy.
Oh, like I said, I just wanted to say that it's very common to have that thought, right? That there's not enough of them. Um, and even though that is true, you can find, like I was telling you, online has really opened this up to mental health professionals. Also, I'm glad I was muted for a while because I had another thought. There's something called peer support specialist, and you can find them too in your area. And that's somebody who's walked the walk and talked the talk, and that's somebody that can be very, very helpful. And then finding support groups is the other thing that I said. Um, just finding people going through the same thing that you're going through, and they'll have ideas of where to find somebody.
So I think we have time for maybe one more question. One of the questions said, my child suffered medical trauma as a baby as a result of a bleeding disorder. I think much of it was avoidable if the hospital would have acknowledged the childhood experiences.
Mm-hmm.
Is there an effort to educate doctors that just because a baby won't remember something doesn't mean that the experience won't affect them later in life? Such a good question.
Oh my gosh, that is a great question. And so, what's happening now is that physicians are realizing the mental health impact of things, and they're getting educated. There's a wave going through the nation that's called trauma informed care. And that is educating physicians or nurses or schools about how the impact trauma can have on kids. And so that's one way I would say that trauma informed care. In fact, I don't know how many years it's been, but I know I would get a lot of relief of my emotions if I were to go back to that hospital and let them know about this and how they could have handled it. One of the big tenets of trauma informed care is that you're very sensitive to helping the child or the person feel heard and validated, and then giving the information. Oh, so this has happened. You might be experiencing these things, and here's the treatment for it. So I'm happy to see it, but we've got a long way. I also wonder about the effects of my husband and myself holding my son down, to infuse him, and what that was like. So I'm with that person.
Definitely. Well, just want to thank you so much again, and also to let people know that on November 13th, we'll actually have another mental health first aid session that Debbie actually hosts for us. And you were amazing, and we absolutely love you. So thank you so much for being our first session of Symposium. So exciting.
No pressure there.
You did great.
And I just want to let the community know that Carlita Gates is a co-facilitator of
Absolutely.
State.
She is amazing.
Cool.
So make sure that you check out the agenda. There's some other things that are happening tonight. And just one more slide here. If I can make it move. Okay, one final thing to mention is at the end of this session, you're going to have an evaluation and it will launch automatically. Don't forget, you need to add your name to the session evaluation to be eligible for the daily drawing. So session evaluations are used to determine content for future educational sessions, and they provide, valuable feedback. We use them every year. So remember, you can return to the agenda on hfasymposium.org at any time to find links to other sessions happening tonight or over the next 10 days. And I just want to thank you again so much, Debbie, for being our presenter today. You were wonderful. And thank you all for attending this session, and have a great symposium, 10 more days of fun. So thank you all again.